Hello, this is Sidhu Jonalagadda. I want to wish Hit TV app all the success for their launch. Please download the app.
I'm Dr. Sumanjan, Chief Medical Research Officer and Secretary of Thalassemia and Sickle Cell Society. This society was formed in 1998 with 20 children. At present, we are having 3,600 and odd patients are with us. They are thalassemia and sickle cell patients. It is a genetic inherited blood disorder which can be easily prevented if we can do HbA2 test before marriage or first trimester of the pregnancy. We can stop the birth of thalassemia major or sickle cell anemia, which is a very costly disorder where the patient need blood transfusion once in 2 to 3 weeks and iron chelating drugs lifelong. Daily they have to take this medicine to remove the extra iron which comes through blood transfusion. It is a very expensive disorder which can easily be prevented if we can form a rule or the government can pass a GO which makes this test mandatory before marriage or first trimester of the pregnancy. Thalassemia and sickle cell patients are diagnosed from the birth because it's a genetic blood disorder, but it can get diagnosed after 6 months of their age. So from birth they are absolutely normal, but from 6 weeks onwards they can start presenting symptoms like not eating food, becoming pale, lethargic, weakness. So they come to the doctor and the doctor advises some tests which gives the diagnosis of thalassemia major or sickle cell anemia. So from 6 months onwards to 2 years of age, and if they get delayed they can come up to 4 years, 5 years of age. So it is the childhood disorder which can go up to the adulthood. And the criticality of the patient is if they don't given the transfusion they don't survive, and even if they don't be given the iron chelating drugs then also they don't survive. And there is lot of complication. They can have infection, they can have a blood, if not is a safe blood they can go with the other complications of HCV, HIV or hepatitis B infection. So they need continuous monitoring. So the monitoring is very important, taking care of the blood investigations. Every 3 months they have to go for the test, and they need multi-speciality people to take care of them, not only the pediatrician, the hematologist, the psychologist, the endocrinologist, gastroenterologist. All branches of the medicines are required to take care of them. So it's a multidisciplinary approach. So it is an expensive disorder, and government should pass a rule like the Cyprus, which they have controlled this disorder by doing prenatal testing, and before marriage they do this test and they don't allow marriages between the two carriers. Similarly, the Taiwan is a country where they do antenatal screening is mandatory in their country. So similar law should be enforced in India also, and which is quite possible. When we have controlled HIV and COVID period also we have control by doing, we have set an example throughout the world. Why can't we do prevention for these disorders? Thank you.
Hit TV app all the success for their launch. Please download the app.
Download the Hit TV app now.
Please download the app now.
Please download the app now.
Please download the app now.
Download the app now.